Hi, everybody. We want to welcome you into Coronavirus Inside the Arizona Numbers, where we take a closer look at the data coming out of the state of Arizona. And I know it's a very busy day today news-wise, but we wanted to make sure that we made time for all of you and got you updated on some of these numbers, especially after the holiday, the longer weekend that resulted in some anomalies in reporting. So we'll walk you through all that, help you understand some of these numbers, try to get a bunch of questions answered as well. And then, of course, if you have any questions or concerns or comments about the vaccination process, we will be sure to make some time for that too. There are a few more places we can tell you about to try to get an appointment if you haven't done so just yet. So I'm Katie Raml, alongside me Garrett Archer, and we want to start where we always do, Garrett, with those numbers out of the state. And you had warned us that today we could see a possible bump in some of those numbers.
Yes, we did see the unfortunately expected bump for the number of reported deaths. However, that being said, our case numbers were quite low compared, where we have been. So today we reported, 4,845 cases and 262 deaths. So what does that mean for us? That is, that puts our case growth in the negative for the sixth day in a row now. We're at about a minus 27%. So we've lost about a third of the number of cases that we report on any given 7-day period right now. And our average has gone down from our high of just under 10,000. I think we hit 9,800 on January 12th as our high as far as the number of reports, cases we're reporting every day. And today we're at 6,900, so 6,973. So the number of cases is going down right now. That's what we know.
Yeah.
Yes. Although today was the third highest we've ever reported, our average, because of this weekend, is still down. Now, I would expect higher death numbers still to come in the next couple of days, because really what we've seen is with these holidays, the death numbers are even more pronouncedly impacted by holiday reporting than even the case numbers. So I would expect another couple of days of heavier death reports coming. However, that being said, as far as the number of cases, things do look a little better today.
Yeah, so it'd be great if cases have peaked and we're on our way down from this winter surge that we've seen. The other two items that we talk about peaking are some of the hospitalization metrics, and then, as you talked about, the number of deaths. Of course, sadly, we're a ways off from that number peaking. But where do things look as far as our hospitalizations then go?
So our hospitalizations right now are in a peak. They're going down from a peak. Now, this is the census counts, and the red is the COVID-19, the gray is the non-COVID-19, and the light gray is the head count. You can see that the hospitals are still maintaining basically a maximum capacity, even though our peak for hospitalizations for ICUs, for example, was January 11th at about 1,183, 65% of all hospitalizations. Now it's down to 1,050. So that's a pretty significant drop in terms of ICU numbers, because they're much smaller than the inpatient numbers. And we've been down for about 6 to 7 days now in total. Same thing with the inpatient. You can see they're keeping the head count at about maximum capacity. But we are down from our peak of 5,082 on January 11th to about 4,663. So about 400 beds or so that is down in the inpatient for COVID-19. And then let's see, our emergency room department numbers seem to be trending slightly down. The number of emergency room department beds that are being held are being occupied at 5 o'clock when the bed count is done. And that's going down a little bit. And then we'll go to the ventilator. You can see there was this weird thing. Just to explain, I'm only going to say this once. I won't really go back to this again, but it looks like there was a reporting issue here. It did appear that the state added about 600 to 700 ventilators. It looked like it was going to be permanent for a couple of days, and then it flipped back to sort of where it was before at least one of the issues. So it does appear that the state did add ventilators. As you can see, they were at about 59% here. Now they're about 52%, but the number of ventilators is the same. So 1,271 and 1,297. There's more ventilators in use today than did at the peak. However, they added more to the system. So it
Yeah.
brought the graph down. And then we'll just really quick just go over these hospitalization numbers, showing this is just a better way of showing what we already told you. We hit a peak so far on January 10th, 11th. We're down from that peak right now in inpatient. Ventilators, the peak only occurred about 3 or 4 days ago. ICU beds, same thing about 6 days ago. Discharge numbers. Now, again, we have to talk about discharge numbers. We have to remind everyone that this isn't just people who are recovering. Unfortunately, in the hospital terminology, discharge can also be a death. And you can see that those numbers are down, but only slightly from their peak. The emergency room department seem to be trending slightly down right now. And then one thing that I really, I don't know if it's an error or not, but we saw a massive drop in intubations from only a couple days ago. And intubation, of course, is when they put someone on a ventilator. And we know that when someone goes on a ventilator, their prognosis is very bad. So we want to see this number down as much as possible. So hopefully this is not a reporting artifact and this is true. And they're not having to intubate as many people, because when this number is high, and the discharge number is high, it typically means that we're not seeing discharges from recoveries. We're seeing them from deaths. And that's a very sad situation. So we want to see this intubation number to continue to go down.
Yeah. All right. I want to get to some of the questions. We have some really awesome critical thinkers with us on here today. So I want to get to some of the comments and questions and get things answered for people. Brian asks, and he's referring to the drop in cases. Would that drop be because people aren't being tested like they were previously, which is a real concern? We're seeing some of these testing sites now being changed over to vaccination sites. And obviously that is of huge focus. But how are our testing numbers through all of this right now? Are they still remaining as high as they've been, Garrett, week over week?
They're actually, it does appear that our testing is going down, but it's actually staying pretty high when all things are considered. I'll show you the graph right now. This is the epi graph for testing. And it shows sort of where, oh, hold on a second. Sorry about that. Let me go back to this. Okay, so this is the epi curve, and this is the testing, and you can see that we only just recently hit a peak for testing last week, and while it's lower this week, it's not significantly lower than it was back in sort of early December or mid-December when we were already going through another peak. So while the testing numbers are slightly down, that doesn't necessarily mean that our case numbers are going down. It does appear in some cases that are in some ways of looking at the data that our case numbers are going down, and simply because we can see that also in the positivity numbers. So when we look at the positivity rates, which are right here on this chart, you can see this green line here is the positivity rate, and you can see it was climbing in early July, and now we've started to see a precipitous decline in the positivity rate. So hopefully that continues. And as long as that positivity rate is going down with the testing, it means that our case numbers are going down. So if for some reason we're in a situation where our positive, and we have been in a situation, by the way, Katie, obviously, where our positivity rate continues to go up, but our testing goes down, then yes, they're like, oh, well, our cases are going down, but it's like, it's artificial because it's less people testing, but our rate is going down as well. So that's encouraging news.
Yeah, a really good question from Brian. So I appreciate that. That kind of leads into Trisha's question as well. She is asking about the percent positivity right now. Specifically, she was asking down to a zip code. And I'll have to scroll back to get to Trisha's comment again to find the zip code. Can we drill down that specific? Our percent positivity rate at best would be down to maybe a county level.
So yes, county level for these daily positivity rates. For zip codes, the best we can do is what Maricopa County gives us and what Pima County, where you can get a weekly positivity rate from not this week, but the week prior. That's the best we can do with that.
So Trisha, to answer your question most accurately, we'd have to wait till tomorrow's numbers come out, right, Garrett, to get that to get a most recent zip code percent positivity for her.
Let's see. I can just do that one really quick while we're sitting here. Because
awesome.
She asked a question. So I'll just
do that. Thank you for doing that. And then if you can highlight our go ahead.
So 85033 last week had a positivity rate of 30%.
Wow.
Which is just incredibly high. And it also had a COVID-like illness going up from 12 to 14%. So this is a zip code that definitely was, it was one of the rising zip codes and rising pretty quickly at the time. It might still be rising, by the way. It's just that we have to wait till next week.
Right. And so then how does that compare to what we're looking at on a broader level? How are we seeing that maybe across the county or even across the state for
Uh,
percent positivity?
we are seeing, so if we look at the positivity rates, and I'll go to the weekly positivity rates for this particular question, and we have to go to the counties because that's the lowest we can go. We'll go to the laboratory testing on
Mhm.
the azdhs. We'll come down here, change this to diagnostic testing, and you can see these rates here. And this is what I'm talking about. You can see we hit sort of a peak on December 27th of 24%, and we've actually gone down a little bit. I'll go to Maricopa County. You can see Maricopa County being the biggest county. That's basically what its numbers are. But let's scroll through some of these others. Pinal County, it's gone down from 26 to 23. When we look at Yavapai County, it's gone from 30% to about 21%. Coconino County, from about 18 to 20% down to about 14%. Pima County, 23% to about 19%. Let's go to Yuma. Yuma was a hot spot. Yuma was about 30%. It's only gone down a little bit to about 29%.
Mhm.
So still some very high numbers in some places. 29%. Ignore this 35%. There's only a couple tests there, but 29% to 25% Mojave. But you can see for the most part in most counties, there is a tendency, there is a downward trend in almost all situations.
Okay, and I just want to barrel through more of the comments and questions so we can really be of service to everybody here today. Sally is asking about the pharmacies and why can't basically the pharmacies be giving out the vaccine? And Sally, you're one step ahead. We have some good news, at least some good news for those who are over 75. If you are in the over 75 age group, they do have the vaccines in 8 pharmacies in Maricopa County. You're going to have to check with I'm just assuming you're in Maricopa County, Sally, if that helps. It'll be expanded to other places and may already be in pharmacies in other counties. But the 8 that are in Maricopa County, I've posted them over on my Facebook page if you want to list for later. Well. And Garrett can bring it up for you right now so you can get a peek. Yes. Garrett, if you scroll all the way down to the bottom, it's going to give a list of 8. And here they are. So it's 3 Albertsons, and it looks like 5 different Safeway locations. They're sprinkled all across the valley. So you've got Scottsdale, Phoenix, everywhere.
Yeah, this is definitely sprinkled across the valley. I mean, you have one East Valley, you've got one West Valley, a couple West Valleys here, one in Sun City West, and then another in the West, and then Scottsdale, and then 2 Phoenix locations.
So I just want to stress again, this is for 75 and older. This is not for the well-discussed, well-advertised 65 and older group that was available to start putting their appointments in on Tuesday. That is only for the state-run sites. So there's been so much confusion about those 2 different situations, those 2 different cases. So on the county level, they're not to that point yet. It's the statewide, the 2 statewide sites, which is State Farm Stadium and over at Tempe Municipal Stadium, that they have that 65 and under that so many people have been really struggling to sign up for. Now, I can tell you, Phoenix Municipal Stadium, they are closed out of their appointments at this time, but you can still make some over at State Farm Stadium. So hopefully that will help. Again, that list, since you might not have a second to jot this down or a place to jot it down right now, it's over on my Facebook page too, so you can take a closer look at facebook.com/news from Katie, those 8 sites listed there. And a little more details, they say that they refresh the appointments on a weekly basis. So if you log on and you don't see any available to you right away, try back again the next week. So hopefully that helps. Garrett, we do have some numbers on vaccinations here in Arizona. I believe we're at 319,000 vaccinations for Arizonans. So that's already given out. And then 44,000 for the full series. So they've gotten both shots already, 44,000. So we're making progress.
Yeah, 320,000 vaccines administered. You can see our per capita rates are about 4,000 almost everywhere. We have a slightly lower number in Navajo County and Yavapai and Yuma, and La Paz at being but they're still in the 1A, the one place left in the 1A. But everywhere else is in the either 4,000 to 5,000 per capita range is the number of vaccines coming out. And as you said, we have about 875,000 that are ordered. And the partial series, 270,000 Arizonans have at least 1 shot. And then the completed series, 44,000. Those are people that would mostly be in the 1A category because they're the ones that, would be basically have that 28-day window already taken care of. And so about 44,000 people are fully vaccinated by this thing apparently at this point.
Yeah, Margaret was asking a little bit more about the vaccination phases. So just want to highlight that for everybody. Phase one that Garrett just talked about is our healthcare workers, healthcare support, any emergency medical service workers, long-term care facility, that's both staffing and residents. And then a lot of these counties moving into prioritized phase 1B, that's all of our teachers, our education workers, childcare workers, protective services, people, any adults over 65 as well. So anybody 65 and older, and then anybody from 1A that they haven't gotten to yet. Then phase 1B is our essential services or critical industry workers or adults with high risk conditions who are in a congregate care setting. And then we get into phase 1C and then phase 2 and 3. So on down the list. Hopefully that helps to kind of let everybody know where they fall in that. A lot of questions came in, Garrett, about where to find this information and how things look and frequently asked questions. And you can find that on azdhs.gov site or also on your county site. Mary's asking, is February already booked to get the vaccine? I try to get an appointment for every day in February at both Glendale and the Phoenix locations. Okay, Mary, I want to make sure that you're checking out the state sites because there's a Tempe site and then there's the Glendale site. Tempe's sold out, filled out. There's no spots left. And State Farm Stadium did have a few. They were in the last part of February. Karen's saying my aunt called today to 211 and there were no more appointments. I'd have to double check to find out if there are no more right now. And it does depend on the group that your aunt is in as well. So hopefully that helps. Garrett, you haven't heard how many are left at State Farm. Yesterday there were thousands.
I haven't heard anything. Yeah, I know we've had some reporters that are on it. Like really know exactly how many are left over, but I don't know right now. No.
Yeah, as of yesterday, there were tens of thousands of vaccines left or vaccine appointments left at State Farm Stadium. Again, they were in that second half of February. That's when my mom was able to get in to an appointment. The later half of February, it was easier to refresh those dates. Don't go into March. The March appointments aren't out there yet. Everybody's like, I didn't find anything in March. You won't. They're not in there. So again, if you're looking at a state site, and you can be from anywhere in the state. So I know it's a drive for people, but we highlighted the story of just an awesome lady who was making her way in from Yuma to be able to get her shot. And it was just a really cool story because she really hadn't left her home and was so excited to be traveling up to Phoenix to get her shot and be able to take part in creating change and getting our life back to normal. So let's see. Want to get to some of the other things as well, Garrett. Our projections. We did not have time for this yesterday, and I want to make sure we get those questions answered as well. How things look going forward, what we can expect from all of this. The new numbers, it hadn't been updated in a while. Thankfully, a more recent update came out to sort of let us know how things look and also put in how vaccines can help affect this curve and get us back to normal.
Yeah, and what we've seen is the modeling shows essentially what we have been saying is that the vaccines don't really play a role in the curves at this point. Mm-hmm. They're just even at rapid rollout at this point, they're not making that much of an impact on the numbers. So this is where we are. This was just updated on January 15th. And so we hadn't looked at this for a while because of it hadn't been updated. Before that, it was not updated until I think it was December 23rd or something. So since they just updated it, we'll look at it. We have projections and rapid rollout as the two options. I'm keeping all the other options out because they're not likely at this point. And you can see the numbers barely move. It does believe that we are going to peak and barely move in our deaths at around the end of March. We're going to basically flatline on the number of deaths that we're reporting. And we can see that here as well. This is the total daily deaths. It does expect that our numbers are going to continue to rise in deaths until about February 1st. Everything I see in the data right now with hospitalizations seems to indicate that as well. And then after that, we should start to see a pretty aggressive decline. And you can see, again, the vaccines don't kick in until about late March. And even then, it's a fairly minuscule number of what they're doing. So we look at the hospitalizations and the resources. We'll start with ICU beds. Right now, you can see that it does believe that we're at about 1547. 508 available. I don't know why it says 508 available. We have more than that, but it does believe that we are going to peak in ICU basically in the next week. It thinks we're going to peak in ICU I would assume that also goes with hospitalizations as well. Yes, absolutely. And then for the daily infections, I'm going to take this out. So that we only have the two. It does believe that we are on a decline already on the number of infections. And you can see, as we talked about, again, the vaccine barely makes a dent on the number of infections that we're seeing right now on a daily basis.
So maybe not as much hopeful news, except for the fact that after February, things could be better as far as the deaths go.
What it does look like is that regardless of what is happening out there, they think because of seasonality and just how these things play out, that we will likely start to burn out, at least for now. And by the time we get into the sort of mid-spring, I guess the hope is at this point is that there'll be enough people that have been vaccinated that it couldn't do a second surge. Is what I just presume would happen, because eventually, they're going to start to try to release some of these, once we start seeing lower numbers in our positivity rates and some of these other numbers, they're going to start reopening things a little more. I know we're not locked down here in Arizona, but they're going to reopen a little bit more. Some places might experiment with taking out masks, and we'll at that point, vaccines hopefully have, there's enough people out there that we wouldn't see another surge.
Yeah. Speaking of masks, though, what we can expect, what we are hearing, I try not to bring politics into this too much, but we do want to update you on President Joe Biden's plans for coronavirus. We are hearing that he plans to have a mask mandate for 100 days. So we don't know when that will be announced or come out. We also have heard that he plans to end the U.S. withdrawal with the WHO. Those plans could also be coming. And then some changes in all of this today. I know it was a social media meme that went around about, we'd all be vaccinated quicker if Amazon was in charge. Well, perhaps they will be, because Amazon has sent a letter to President Biden saying that they would like to help out in all of this. And if there is some way that they can be of service to get this done, that they would like to, so that possibility in businesses and other entities helping out is on the table. A little bit earlier, Judith wrote in the comments about a dentist office being able to give out the vaccine, and she's hopeful that a dentist office can do that. And she's on the right track. Judith, you're absolutely right. One of the big concerns is having a freezer, of course, that these vaccines could be kept in, or having another vaccine make it through FDA approval that does not have to be kept at that cold temperature, thus could be kept at your dental office, and you could get it there. So it's not far off.
I don't think the Moderna vaccine doesn't require the same temperatures as the Pfizer vaccine, right?
I'm not sure if that's I think we have to wait for the Johnson & Johnson one.
Yeah. Okay. I don't remember, because I for some reason thought that the Moderna was it didn't have the -40 or whatever requirements, but I'm not sure.
Regardless, we're getting closer, and that will be an option in the future, and that is part of the plan. It just we're just not exactly there yet for the distribution. So it could be yearly, that when you go to get your teeth cleaned every 6 months, or the picture taken, the X-ray, that they'll also give you a booster shot or something like that. So it's not at all far off. We're talking about some of the problems running into getting everybody vaccinated, and who has shots and who does not. And we're just learning also that New York City is having to close some of their vaccination sites because of a lack of supplies out there. So it's kind of happening everywhere. Linda's saying, Garrett, you're right about the temperature difference. So we're not that far off from being able to do that at the dentist's office. It's really it's got to make it easier somehow. Another person posted in my comments, if they could just let Chick-fil-A do this, we'd get it done a lot faster. How they push everybody through the lines there. So there are some business entities that people are looking at to take a cue from, to be able to get this done, to get everybody taken care of. Let's see. There was a briefing out of ASU earlier this morning too, and I want to make sure, I'm going to ask producer Carrie if we can catch that on our ABC 15 page. I know that normally we would have that on there. The update would be on there, but I'm not exactly sure if we were able to post it today, because we had so much other breaking news happening and developing stories across the U.S. But I know that update came out this afternoon as well. We are now hitting 24 million cases here in the U.S. Our total death numbers, as you all heard, went over 400,000 this week. We're now at 404,000 here in the U.S. for deaths. And then comparing that globally to 2 million deaths and 96 million total cases. All right, Garrett, as we look at some of these numbers, boy, and these total numbers of deaths across the country, I know this is something that you watch closely with our Arizona numbers, not necessarily with our United States numbers, but for compare, September 19th in the US was the day we hit 200,000. December 14th was the day we hit 300,000. January 19th was the day we hit 400,000.
It's
So
on an exponential curve at this point, yes.
exponential. And it's not unlike what we saw here in Arizona as well. Some of those numbers you put together on obviously a smaller scale, where we hit 1,000, 2,000, 3,000 on up to now 11,000. But we did see a similar curve in those numbers and their growth exponentially.
Correct. I'm looking at it on, I'm bringing up 91 DVALC right now. I was looking over here. This is, like I said, we go here all the time to sort of check where everything is. I've got, let me just bring up the United States here. This is what you're talking about. You can see that this is where it's hit that it sort of went into exponential curve about 50 days ago when we were at about 271, and then it accelerated and has been on the same track since then, from 271 to 401 in 50 days. And you can see it's a little less than the European Union right there. That's the numbers you're looking at. I was also coming here so I can look to see if we were still the world's hotspot. We are not. Arizona is now just under Portugal for the number of new cases. So we're number 2, but no longer number 1.
Yeah. And that's an interesting curve line for Portugal too.
Correct. It's probably has to do, of course, with the B117 virus over there, the variant over there. We saw what it did to Ireland, and it looks like it's sort of going through some of the other European countries, over time, and seeing their curves sort of switch and, go from these sort of lower numbers to just skyrocketing up.
So when we're talking about that variant, we found another place that you all can track it as well. If we get so many questions on it, and so I know it's a hot topic for so many of you who follow us on here every day. And you can find that information from the CDC. Garrett, they've put together an interactive map where they show state by state how things look for certain variants. And the concerning thing, although it's registering 0 here in Arizona, so not detected yet, it could be here. We've got 40 cases next door in California. We've got states all around us.
So
Are you able to share your screen?
I am. Yeah, I'm ready to go. So this is the CDC's. They're checking. They're checking for the B117, and that's the UK variant, the one that spreads at about 50% the rate of sort of the typical variant that we've seen. And you can see, yes, Arizona still has 0 cases of this detected. However, every state around us essentially has at least one. And as we've known from starting this, the biggest problem with COVID-19 is basically we're always about 2 weeks behind the curve, no matter what we do. So if there's already 40 cases when this was taken in California, that number is likely much higher at this point, and could have already gotten into Arizona. We just haven't sequenced it yet.
Yeah. So this is one of the places to track it. Again, this is on the CDC's website, but a little bit of an interactive map if there's other states you want to check out. Margaret was asking, any news on the variant, the vaccine, basically having protection against the vaccine for these variants? And lab studies are suggesting still that Pfizer specifically, that their vaccine is effective against all mutations in the UK coronavirus variant. So they're all kind of trying to keep us updated as this story sort of evolves with these variants that are out there. But that just coming out this afternoon. All right, Garrett, as promised, the RT Live and RNOT was sort of a number that had been not as stable over the past few days because of our changing numbers coming out after MLK holiday and some anomalies in offices being closed. Has it stabled out? Is it a number that we can look a little bit closer at now?
So it's still our number is still quite high, and I tend to think that this is a little higher than it should be at this point. I think we're already we should be in the green, in my opinion, right now. I think we're going to switch over pretty quickly here. It's showing us at a 1.0 or 1.08. Just under Washington and Hawaii with a 1.14, but Hawaii always has the biggest error bars of all the states, simply because of their isolation from the rest of the country, as well as their much smaller population. And so they always have a higher error bars. But you can see we're one of the only states still that are sort of in the red. Almost all the states are in the green. I tend to think that this will change to the green probably by next week. We're already seeing declines and no indication right now that the numbers are going to skyrocket back up. But again, this could change on a dime. So it looks like right now, this should be heading in the correct direction very soon.
And that would be better news when we're seeing all those states in the green. We hate to be, one of the problem states in the red.
Exactly.
What was that?
Yeah, we don't want to be left out and be one of the states in the red where everyone else is enjoying a green moment. So
right, exactly. All right. When we talk about some of these case numbers and how many people end up in our hospitals here in Arizona, what we've been looking closest at is Maricopa County being one of the most populous counties, both the most populous county in Arizona, but obviously also across the country at number 4 for population. We're still seeing about 7% of those cases end up in our hospitals here in Maricopa County. Is that correct?
Yes. Let me just check really quick to see if that is still correct. It is.
It had been for a while. 7% of our cases end up in our hospitals, and 1% ended up in our ICUs. So it was a lot of times people just were at a point in the pandemic, both good and bad, that people dismiss the case numbers as, oh, it's just a case, but really it still ends up as a hospitalization for 7% of those. And you presented some really interesting numbers that really spoke to the age group when we are experiencing this. And I hope it's not too repetitive for those who are with us on Tuesday, but I thought it was maybe the most important thing that you updated us on. And we're so lucky because we're at the point in the pandemic that we have enough numbers, we have enough raw data in that we can look at these things with a bit of perspective and learn something from them. And what you're saying is this 65 and older group, we knew they had higher hospitalization percentages, but you're saying it's much higher than the 7% that we're seeing for the broader.
Significantly higher. So I haven't updated this since Tuesday. So these numbers could be slightly different, but your hospitalization rate for the 65 plus, for anybody who basically tests positive, so a confirmed positive for COVID-19, the hospitalization rate is about 24%. So 1 in 4 people that get tested in that age group are going to go to the hospital. As soon as that happens in that age group, if you go to the hospital, if you're one of those 1 in 4 people, your hospital fatality rate is about 40%. And that's obviously very sad. Now, this is an estimate because there are some people that do get COVID-19, even that age group, and then don't go to the hospital and die. So that can happen, but most of them are going to die at a hospital. And so this is an estimate. I brought this estimate through with doctors, and they say that it is a reasonable way to estimate this number. And so about 40% of those 65 up who go to the hospital will pass away from COVID-19. For the next level, 55 to 64, for the 10% of cases that go to the hospital, 20% of those, so 1 in 5 of those are going to end in a death. Of the 6%, 6% of the 45 to 54, 7%, 10% of those. So you can see it drops in both categories very quickly. 10% of those are going to end up in death. And then when we get to the 20 to 44, only 3% of those cases are going to go to the hospital, and only 5% of those cases are going to end in death. And then that final category, 0 to 20, 1.2%. So just over 1% are going to go to the hospital, and only 1% are going to pass away. Of that 1%, only an additional 1% are going to pass away from COVID-19. So as you can see, that particular age group, the chances of death are extremely small at this point. Still, obviously, very sad when it happens. But this is one of those things. We see that 77%. We see people say 99% of people recover from this. But again, if you're of a certain age group, that 99.9% number does not mean anything to you because you don't belong in that age group. You don't belong in that number. Your chances are closer to 94%. And that's talking everybody. That's not even talking people who get tested and confirm positive. It's just, 94, 95% chance, that you're going to live. But still, that's not great if you think about it.
Yeah. Deborah's asking a really good question. So do we have numbers for people like 70 to 80 in their 70s and their 80s?
No, those are internal hospital numbers. I'm sure that they have that at AZDHS, but they do not share them with us. There might be some numbers that are general throughout the entire United States on what those numbers are. But and I haven't looked at those, but I'm sure they exist, but they do not give us those numbers. 65 plus is the best we get. Now we do know, based on some of these factors, that it's not really it's really the 80 plus, 85 plus that in this category is making up the bulk of these 40%. I know 65, it goes all the way down to 65, but really it's that 75, 85 plus, especially 85 plus, where, you know, your fatality rate goes through the roof. I think it's close to 15 to 20%. And that's just everybody. That's that everybody rate, you know, that people like to use.
Yeah. Jamie's writing, I'm still in bed, third week. I mean, a lot of people are going through this. This COVID sucks. I've missed 3 weeks of work, still sick. Lots of random symptoms. That's the thing.
It's very random. I mean, I've got a splitting headache today, and I don't know if it's like if
it's COVID or something else.
Yeah, so I don't know if it's the residual from COVID-19 or if it's just a headache. I don't have any other symptoms at this point, but it's just still sitting there with a headache.
I can hear it in your voice still.
Yeah, you can. Okay.
Yeah, yeah. But I've noticed that for the people, sorry, you sound great. For the people who have had it and have recovered and tested negative and then come back to work here, you know, we listen very closely because we're always wearing earpieces. I know, you know, mine are visual right now, but when I'm on the air, I'm wearing something called an IFB, and it's right here. It looks like this, and so I can hear directors and other people in my ears, and people do sound different after they've had this for the most part. Their voice sounds different. Have you tried, I know you're a singer, have you tried singing since then?
No.
Or have you tried just trying to rest your vocal cords?
Yeah, I haven't really, no, nothing that I can, I haven't actually done any sort of like actual vocal exercises to see if I've lost any sort of my upper range yet. I'll figure that out a little bit later.
Yeah.
So, but other than sort of that and the headache I have right now, everything is okay. So
yeah, you'll have to, you know what you should do? You should watch this back and then see if you sound different to you. I know we always sound different, but working in this business, we hear our voices a lot more. So it can be not as jarring, I guess, to people outside of the business. Deborah writes, I agree, Katie, there is a COVID voice for sure. And Lisa's writing, I had it twice at 57 and I'm okay. However, my cousin passed away today at the same age. Lisa, first of all, I'm so sorry for your loss. I don't know if they were here in Arizona, but we always take a moment to try to remember those who have not only lost their lives to this, but the family that is left behind disproportionately suffering through this pandemic. So we think of you. Lisa, I don't know if you watched any of the inauguration today either, but there was a moment of silence for the 400,000 that we've lost, now 404,000 here in the United States. And I couldn't help but wonder if we had paused for a moment of silence nationwide, maybe each month, to remember those that we'd lost, if we would have been in a different situation, because it was such a moment of, we all got to do something to make this better and make sure that we can get this thing solved. And hopefully that this more hopeful news today of the sort of downturn in some of these cases since January 10th and January 11th will stay with us, and that we'll be able to get out of this a little bit quicker. All right, Garrett, we only have a matter of minutes left. We're not going to be with folks tomorrow because, again, we are working on another project. You're not here either, right? Neither of us are here tomorrow with our project that we're working on.
Yeah.
So we'll be back with you on Friday. But I'm just curious, Garrett, what things you'll be watching in these next couple of days. Do we still expect some higher reporting days because some of these numbers are trickling in a little bit?
I mean, at this point, I fully expect we're going to see higher death reports in the next couple of days. The case numbers, I was expecting to have a higher case number today, and it didn't happen. So that's one of the reasons why it looks like we might be heading on a decline. So just basically looking at what if our downward trends continue on all metrics, cases, tests, tests that could still happen, hospitalizations, we figure deaths are going to continue to rise, but the others should start to fall. And once they start falling, then deaths should follow shortly after.
Mm-hmm. All right. So those are the things that we'll be watching. Oh, Jamie's posting that her feels like her eye stems hurt. Have you had any different experience with your eyes?
I haven't felt that. Sarah's
writing the same thing. My eyes are much more tired now.
Yeah, no, I don't. that didn't hit me. So
a whole slew of different experiences that obviously they'll be studying for years to come as we try to work to understand what just happened throughout this entire pandemic in this past year that we've been reporting on this and watching this happen here in the United States. All right, that's going to kind of put us right up at the end of the hour. Tomorrow, though, Garrett, they are going to update some of those school numbers, correct?
yes. Yeah,
So
we should have a new update for tomorrow. Yes.
yeah, we want to let everybody know where they can find that. That is courtesy of Maricopa County. So obviously our school updates are going to be on abc15.com. You saw the address right there, abc15.com/schools. A lot of kids going back to school just this last Tuesday, not mine. So I'm all confused on the days. Yesterday, I believe. Yeah, yesterday, a lot of people went back to school. But the list of schools and the closures and the changes are on abc15.com. And then the updated information that's going to come out for your particular school district or your grandkids' school district is going to be over on the Maricopa County site. And then we'll help Garrett, we'll help them find perspective on some of that on Friday when we're back with everybody. So if you want that web address, here it is, Thursday afternoonish. You'll be able to check it, gis.maricopa.gov/COVID/schools. So once again, gis.maricopa.gov/COVID/schools. So those updates will come in the afternoon. And again, we'll help you find perspective. In the meantime, let me let you know where you can find us. Garrett is on Twitter. Garrett, I included you in a tweet yesterday, and I feel like it went viral. Like I think it's just I'm going to tag you in everything. I'm going to be like, here's a cute picture of my kids. Tag at Garrett_Archer. Because apparently it's pretty popular. So at Garrett_Archer is the place that you can find him. His updates are going to come in the morning for you. Also, my Twitter account is at Katie Raml. You can just find me linked to his at this point. And then we can also connect over on Facebook. Many of you are watching there right now. That is facebook.com/news from Katie. And I want to remind you, all of our coronavirus reporting can be found at abc15.com/coronavirus. And our newscasts come up in just a few minutes at 4, 5, 6, 6:30, 9 over on the CW, and then back on ABC 15 at 10 p.m. So a lot of places to find our very latest coronavirus reporting, and we'll invite you back here on Friday at the same time, same place. In the meantime, everybody, be safe out there.